Have you ever wondered why some seniors seem to radiate energy and confidence well into their golden years, while others feel their spark fading? I'm Dr. Anna Schneider, a physician with over 20 years of experience helping Canadians live healthier, fuller lives, especially as we age. Today, I'm here to share science-backed secrets to boost your well-being, strengthen your relationships, and take back control of your body. If you're ready to feel proud of the life you're building, stick with me, this is for you. Drop a comment below. Which Canadian city are you watching from? Let's connect and make this a conversation. Aging is a privilege, but let's be real, it comes with challenges. As a doctor, I've seen how physical changes can ripple into every part of life, from your confidence to your closest relationships. Today, we're diving into a topic that's often whispered about but rarely addressed head-on: how to maintain vitality and intimacy as we age. This isn't just about the bedroom, it's about feeling like you again, strong and connected. Whether you're in Vancouver, Toronto, or a small town in Alberta, these tips are for you. So grab a coffee, hit that like button to share this with others, and let's get started. Let's start with a stat that might surprise you. Over 50% of men over 60 in Canada experience challenges with erections, according to the Canadian Urological Association. That's half the population. But here's the kicker, it's not just a physical issue. When your body doesn't respond the way it used to, it can shake your confidence. I've had patients tell me they avoid closeness with their partners, not because they don't love them, but because they're afraid of failing. That fear builds a wall, silence creeps in, and suddenly, a marriage that was once warm and vibrant feels distant. Picture this, a patient I'll call John, a 68-year-old from Calgary. John was the rock of his family, always confident. But when he started struggling with intimacy, he pulled back. He stopped holding his wife's hand, avoided her gaze. She thought she'd done something wrong. The truth? John was wrestling with shame, too afraid to talk about it. That's the emotional divide we're tackling today. And it's not just men, women, too, face changes that can dim their spark, from hormonal shifts to stress. But here's the good news, you can turn this around. Let's break it down like friends over coffee. Your body is like a finely tuned machine, and aging can throw a few wrenches in the works. For men, strong erections rely on three key players: blood flow, hormones, and your pelvic floor muscles. Over time, arteries can stiffen, making it harder for blood to reach where it's needed. In Canada, heart disease affects 1 in 12 adults over 60, and the same issues clogging your arteries can weaken intimacy. Then there's testosterone, it naturally dips with age, slowing desire and response. Studies show testosterone levels in men drop by about 1% per year after 40. For women, menopause brings its own changes, lower estrogen can affect energy and libido. But it's not just physical. Your mind plays a huge role. Stress, anxiety, or even a tough day can flood your system with cortisol, hitting the brakes on arousal. Conditions like diabetes, high blood pressure, or high cholesterol, common in 30% of Canadian seniors, can also dull sensation and make connection trickier. Medications for these issues, like some blood pressure pills, can lower libido too. And let's not forget the pelvic floor. These muscles are unsung heroes for both men and women, supporting control and strength. Without care, they weaken, making intimacy harder. But don't worry, I'm not here to overwhelm you. These are challenges, not dead ends. Science has solutions, and I'm sharing them with you today. Here's where we take back control. You don't need magic pills or quick fixes, you need small, steady changes that add up. Let's start with your body. Cardio exercise, like a brisk walk along the Halifax waterfront or cycling in the Okanagan, keeps blood pumping strong. Aim for 30 minutes, 5 days a week. Weightlifting, even light dumbbells at home, can nudge testosterone up. Food matters too. Beets, watermelon, and leafy greens boost nitric oxide, easing blood flow. Cut back on sugar and lean on proteins and healthy fats. In Canada, 60% of adults don't get enough vitamin D, which fuels hormones, so consider a supplement, especially in our long winters. Pelvic floor exercises like Kegels are a game changer. They're simple: squeeze the muscles you'd use to stop urinating, hold for 5 seconds and release. Do 10 reps 3 times a day. For men, this can mean firmer, longer-lasting results. For women, it boosts control and sensation. And don't sleep on sleep. 7 to 8 hours of deep rest balances hormones and cuts stress. A 2023 study from the University of British Columbia found poor sleep doubles the risk of low libido in seniors. Now, let's talk about your mind. Stress is a thief, it steals your energy and connection. Try deep breathing. Inhale for 4 seconds, hold for 4, exhale for 4. Do this for 5 minutes daily. Mindfulness or even a quiet walk in a Manitoba park can calm your brain, making intimacy feel natural again. If you're struggling, talk to your doctor. Treatments like Viagra or hormone therapy can help, but they're not the whole story. Natural options, like maca root or ginseng, show promise in studies for boosting circulation and libido. Here's the heart of it: intimacy isn't just physical, it's emotional. Silence is the real relationship killer. I've seen couples like John and his wife drift apart, not from lack of love, but from fear of talking. In Canada, 1 in 5 seniors report feeling isolated, and that loneliness can creep into marriages. So take the leap, talk to your partner. Share your fears. Most partners respond with care, not judgment. That openness rebuilds trust. Try this: set aside 10 minutes a week to check in with your partner. No distractions, just honest talk. Ask, how are we doing? What do you need? It's like planting a seed for closeness. And don't be afraid to seek help. Couples counseling or a visit to a urologist can be a lifeline. In Ontario alone, over 10,000 seniors access sexual health clinics yearly, and they leave empowered. Let me share a story that inspires me. Margaret, a 70-year-old from Victoria, came to me feeling defeated. Her husband, Peter, had pulled away after struggling with intimacy. They barely talked and Margaret felt unwanted. After some tests, we found Peter's cholesterol and stress were culprits. We started small: daily walks, a better diet, and Kegels. Peter opened up to Margaret about his fears, and she listened with love. Within months, they were laughing again, holding hands, feeling connected. Peter didn't just regain physical strength, he rediscovered their bond. That's the power of facing it head on. You are not defined by your challenges, you are defined by how you rise to meet them. As Canadians, we're tough, resilient, and proud. Whether you're in Montreal, Saskatoon, or St. John's, you have the power to take control of your health and relationships. Start today, pick one tip, maybe a walk, a Kegel, or a heart-to-heart with your partner, and commit to it. I've created a free guide, Rediscovering Vitality After 60, with more actionable steps. The link's in the pinned comment, grab it before it's gone. I want to hear from you. Drop a comment: what's one step you're excited to try? And which Canadian city are you in? Hit that like button to share this with others, it could change someone's life. Subscribe and ring the bell so we can keep this journey going together. Let's make aging a time of strength, connection, and pride. I'll see you in the next video.